Okay, the surgery might bring your vision back to 2020. You might experience some dryness.
The surgery will bring your vision back to 2020. And cure your temporary blindness. However, you may have permanent side effects such as haloing or something or other.
The surgeon will help bring your vision back to 2020, but you might have the side effects of yellowing, something or another.
The surgery could repair your vision and improve your night vision, but that's all I can remember.
The surgery will bring your vision back, but you may have some side effects such as blurring and difficulty during night vision.
The surgery will bring 20/20 vision is what I can remember. That's about it.
The surgery will bring your vision back to normal. Oh man, I'm glad I'm not an interpreter. And you may have halos and blurring.
The surgery will bring your vision back to 20/20 and cure your night blindness. However, you may have the temporary or permanent side effect of haloing and or ghosting, especially during night driving.
The surgery will bring your vision back to 20/20 and cure your night blindness. You might have temporary or permanent issues such as haloing or ghosting, particularly during night driving.
Please speak one at a time so the interpreter can interpret.
Interpreting is the act of orally transmitting a message from one language to another, online and in real time. The interpreter's task is to listen to the message, comprehend the message, abstract the message from the words and the word order, store the ideas, search for the conceptual and semantic matches, reconstruct the message in the other language, while listening for the next piece of information and managing communication. Translating is the act of transmitting a message from one language to another in writing or via scripted video. It is done with sufficient time for consultation with other translators, dictionaries, texts, and researching common usage. A trained interpreter has superior language skills in both languages, specialized medical domain terminology, highly developed memory skills, and the ability to manage the communication lines so that the patient and provider are speaking directly to each other.
Okay, I would like you to take 2 of these pills 1 time a day before eating and for 10 days.
I'd like you to take 2 of these pills before eating for 10 days. Sorry, I'm frazzled.
I would like to take this pill 4 times a day. After the rest I lost, I'm sorry.
I'd like you to take these 2 pills twice a day before eating and take this 1 pill 10 times a day.
I'd like you to take 2 of these pills before eating and 1 of these pills, I don't know, once a day? Once a day.
I'd like you to take 2 of these pills 4 times a day, and this other pill, take it once every 10 days.
Okay, I'd like you to take this pill 2 times a day for 4 days before eating.
I'd like you to take these 2 pills 4 times a day, 1 once a day for 10 days.
In addition, professional interpreters also follow a professional code of ethics. They must remain neutral, seek to be accurate, respect the patient's right to privacy, maintain confidentiality, and behave professionally at all times, showing respect for all parties, cultures, and beliefs. Trained interpreters prevent a lot of problems with ethical violations by insisting on time to introduce their role at the beginning of a session with a new patient or provider who may not be familiar with their role. It is important for all parties to understand that the role of the interpreter is to facilitate communication and not to counsel the patient or provide medical advice. It is also important for all parties to understand that anything that is said will be interpreted. It is important for an interpreter to interpret all sidebar conversations. In this exchange, the doctor will learn about concerns of the family as well as past reactions by a relative to anesthesia because the interpreter interprets the sidebar conversation between the mother and father for the doctor. Such conversations often provide valuable medical information, such as past reactions to medication, attitudes towards treatment options which may affect whether the patient will follow through with the treatment, and barriers in the patient's home culture or schedule which may make it difficult to follow through with a particular treatment option. Additionally, such conversations are important in building rapport between the patients and doctor and helping the doctor understand the concerns of the client.
Your child has many cavities which need to be treated.
cunugtaadi waxay ilkaha ku leedahay suus ama dulduleelo oo waxay u baahan tahay in laga daaweeyo.
Since it's so traumatic for a child to have dental work done and it's very hard for them to keep still,
maadaama ay caruurta dhib aad ah ku tahay in ilkaha laga daaweeyo lagana ilaaliyo dhaqdhaqaaqa,
what we usually recommend is to do all the treatment at one time.
waxaan dadka kula talinaa in qofka bukaanka ah
by putting the patient to sleep with anesthesia in an operating room.
waxaan dadka kula talinaa in qofka bukaanka ah lagu suuxiyo qolka qaliinka iyadoo la siinayo daawada dadka lagu suuxiyo.
waxay leedahay afka ayaa laga qalayaa.
What is she saying? Is she saying that she wants to operate on her mouth? No, it's not that. It's just that they use anesthesia because if not, she wants to stay still so that they can work on her.
laakiin ma ogtahay in dawada dadka lagu suuxiyaa ay u xun tahay dadka.
But you know how bad it is to have anesthesia. Remember what happened to your aunt?
Did I hear you say your aunt had a bad experience with anesthesia?